Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine.
Based on Ultimate 1 and 2 trial results, novel drug BRIUMVI or BRIUMVI gets USFDA approval for relapsing forms of multiple sclerosis patients. TG Therapeutics recently announced the USFDA has approved BRIUMVI, which is also known as ublituximab XIIY, for the treatment of relapsing forms of multiple sclerosis or RMS, to include clinically isolated syndrome, relapsing remitting disease, and active secondary progressive disease in adults. Approval was granted for this indication based on data from the Ultimate 1 and 2 phase 3 trials, which demonstrated superiority over teriflunomide in significantly reducing the annualized relapse rate, the number of T1GD enhancing lesions, and the number of new or enlarging T2 lesions. Results from the Ultimate 1 and 2 trials were recently published in August 2022 in the New England Journal of Medicine. Exposure to nature may reduce the risk of neurodegenerative disease-led hospitalization in the elderly, according to JAMA study. The findings of a recent cohort study published in JAMA Network Open suggest that some natural environments are associated with a decreased risk of AD-RD and PD hospitalization, which stands for Alzheimer's disease and related dementia and Parkinson's disease, respectively. Neurological disorders are the leading cause of disability and the second leading cause of death worldwide. The most prevalent neurological diseases in the US are Alzheimer's disease and related dementia or AD-RD and Parkinson's disease or PD. The researchers wanted to evaluate associations of natural environments with hospital admissions for Alzheimer's disease and related dementias and PD among older adults in the US. Nerve pathway for good and bad feelings identified. Scientists in Japan have identified a nerve pathway involved in the processing of rewarding and distressing stimuli and situations in mice. The new pathway, originating in a bundle of brainstem nerve fibers called the median raphe nucleus, acts in opposition to a previously identified reward or aversion pathway that originates in the nearby dorsal raphe nucleus. Previous studies had already revealed that activating serotonin-producing nerve fibers from the dorsal raphe nucleus in the brainstem of mice leads to the pleasurable feeling associated with reward. However, selective serotonin reuptake inhibitors or SSRIs, antidepressant drugs that increase serotonin levels in the brain, fail to exert clear feelings of reward and to treat the loss of ability to feel pleasure associated with depression. This suggests that there are other serotonin-producing nerve pathways in the brain associated with the feelings of reward and aversion.
That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.